Allow me to recap for members what the Trace Together app does. This is basically a contact tracing app which uses your phone's Bluetooth function to detect other phones nearby. It keeps a record of other Trace Together users whom you happen to be in close contact with. It encrypts and stores this data on your own handphone. And if, in the unlikely event you turn out to be positive or diagnosed with COVID-19, this data is then uploaded to MOH, and the contact tracing teams in MOH use this to quickly identify, isolate patients, quarantine people who may be at risk of having been infected by you and of transmitting the disease onwards. Today, Trace Together has been downloaded on a voluntary basis by 1.5 million users. The number of downloads, particularly given that it is voluntary, is encouraging. Unfortunately, the app does not appear to work as well on iOS or Apple devices, as the iOS operating system actually suspends Bluetooth scanning when the app is running in the background. I apologize for getting a bit technical here. We've had repeated discussions at both the technical and policy level with Apple, but we have not yet been able to find a satisfactory solution. Because Trace Together does not work equally well across all smartphones, we have decided, therefore, at this point in time, not to mandate the compulsory use of Trace Together. Instead, we are developing and will soon roll out a portable wearable device that will achieve the same objectives as Trace Together, but will not depend on possession of a smartphone. If this portable device works, we may then distribute it to everyone in Singapore. And I believe this will be more inclusive, and it will ensure that all of us will be protected. Notwithstanding the limitations of coverage today, the data from Trace Together has already been a helpful additional tool for our contact tracers, especially when it is used in combination with other data sources. In some cases, it has improved the contact tracing process by automatically generating a preliminary list of close contacts for quarantine, and thereby it reduces the time taken to isolate these contacts and to prevent them from spreading the disease more extensively. I would like to emphasize that contact tracing remains a professional skill that is ultimately dependent on human judgment. Technology is an enabler. It is not a replacement for human judgment. We thank those who have voluntarily downloaded the app to date, and we urge more to download the app. We have also just upgraded the app to register the NRIC or PIN number of the user, in addition to the user's mobile number, so that we can more quickly establish the link between the identity of the confirmed cases and their close contacts. To Mr. Gantiampo's question, we do not, at this point in time, have the breakdown of the downloads by gender or age because such data is not currently collected by the app. Yesterday, we issued a written response to Mr. Murali Pillay, who had asked about the confidentiality of the data. And I think it's worth me reiterating that again, that the data is stored only on your own phone in the first instance and accessed by MOH only if the individual tests positive for COVID-19. And this data is only used for contact tracing. There are safeguards, including encryption, in place to protect this from malicious hackers. And the data that's older than 25 days will be automatically deleted from your phone. And if the close contact data is required for contact tracing, only a small group of authorized officers in MOH will have access to it. And of course, all the usual public sector protection rules will apply. I need to emphasize again that quick and accurate contact tracing is a necessity. In fact, it has become all the more essential now that we're emerging from the circuit breaker. Because if you think about it, if everyone is at home, in fact, the need for contact tracing is minimal. But now that we have more people moving about, going to work, there will be more occasions when more people will have more close interactions with each other. Therefore, the collection and use of this data for contact tracing becomes even more essential. It'll speed up the isolation of close contacts and reduce the risk of them spreading COVID-19 to their loved ones, family members, friends, colleagues, and the community at large. If we can reduce the incidence of clusters by better and faster contact tracing, then we can avoid having to reintroduce restrictive circuit breaker measures in the future. So I hope that all members of the public will work with us to achieve this. Thank you.